So I was diagnosed about 3, almost 4 years ago, and I had the chemotherapy, which caused my ovaries to shut down. I went into menopause at 23. I guess some of the popular symptoms, which I also experienced myself, is just low sex drive and discomfort during sex, and your period stops. So that was the only good part.
So I can relate to a lot of those symptoms, especially the dryness. Being married and a dry vagina is not fun.
I think a lot of women are surprised. At age 29 or 32, you're not thinking about menopause. Amenorrhea is the absence of having a menstrual cycle. And premature menopause happens in especially young women going through chemotherapy. There are certain chemotherapy agents that will increase the risk of losing their ovarian function or not being able to have periods any longer. And the highest offenders are usually the alkylating agents, which are pretty common in breast cancer treatment.
The hot flashes, I think that they're worse at night, and I sleep with a fan on my face, and my husband has like 4 blankets on, and I'm sweating my, ass off.
For me, it was a little bit different because I have the BRCA2 gene, so I'm positive for that, which forced me to get an oophorectomy. So I have everything. I have the hot flashes, I have the vaginal dryness, anxiety, I get like the panic attacks.
The symptoms of premature menopause and natural menopause are the same. The difference is a patient who's young and we forced into menopause, the symptoms can be more severe.
So guys, when did the menopausal symptoms finally go away for you?
So if I think back, it's really only been almost 2 years. There are times that I still experience the hot flashes, which is why I keep popsicles on hand.
So mine, I had menopause induced with the chemo and that was about 6 months. As soon as the chemo was over, my periods came back and I started to feel better. And then for the last 3 months, I've been on ovarian suppression, where I give myself a monthly injection to prevent ovarian function. And that will be for 5 years at the minimum.
The proportion of patients who undergo an irreversible menopause is not entirely clear these days. A lot of our studies looked at older agents as far as chemotherapy is concerned, and showed anywhere between 20 to 30% would have a permanent amenorrhea. But the complicating thing is the recovery of the ovary function can happen anywhere between 6 months to almost 2 years. Our newer agents, though, we're still unclear as to what impact they have on the ovaries. Age is a huge risk factor for permanent ovarian failure. The closer one is to a perimenopausal age, so over 40, the more likely the loss of ovarian function permanently will occur.
My oncologist set me up for an appointment with his nurse practitioner before I started chemo, and she's kind of the one who told me what to be prepared for. Then my oncologist sent me to a sex doctor. She's a GYN who kind of specializes in menopausal type issues.
My oncologist just mentioned a lot of the symptoms with chemotherapy, like hair loss, fatigue, things like that. But he very briefly mentioned the ovaries shutting down. But that's awesome that you got to see a therapist and things like that and have that support. But I wasn't even aware that those things were available, and I can seek help on that.
So my doctor probably told me some symptoms and some things, but I think I was kind of at a place of still processing the fact that I was getting ready to have these toxins going through my body. So she probably told me, and I just really wasn't listening.
The major thing about menopausal management is that it's serious, and that doctors like me need to take that seriously and provide some guidance. And patients also need to bring it up as a concern, because if it's distressing, then it's something that we need to help relieve.
So did you ladies have hot flashes? Like, how did you deal with the symptoms?
I tried to take control over some of the things that I could take control of, not overdressing for an occasion. So I always wear usually like a light tank top or a short sleeve shirt underneath everything that I could take off. Also, just not being embarrassed about it, not denying it, just saying, okay, I'm having a hot flash. Who's got a fan? Let's go.
So I did start yoga to kind of help me relax, not be as anxious and have anxiety. So I've been doing that, and I did schedule for like acupuncture and massage therapy as well.
So I'd seen commercials and I'd heard about vaginal dryness, but I guess until you really experience it, you really just don't know. So my husband was very patient, and I'm certain at times he probably thought I was faking, and I may have been, don't tell him. So I didn't really want to try like those potions and creams and things of that nature. So I actually used coconut oil, and it worked. I was completely surprised.
Simple things can be done to help menopausal type symptoms. Physical activity appears to be the panacea for poor quality of life, and that can certainly help. There are medications that can help with menopause, from gabapentin to some of our antidepressants. They have the added benefit of reducing the symptoms of menopause, especially the vasomotor symptoms or hot flashes. For women who don't want to take medications, complementary therapies can be of use, such as acupuncture, such as hypnotherapy.
So at 27, 4 years out of treatment, I'm really fortunate to say that I think I'm back to my normal self, or what is my new normal. My sex drive is back. The vaginal dryness has decreased significantly. I don't think it has gone away entirely, but it's getting there. It's getting better.
I'm 35. My menopause is here to stay, with ovarian suppression most likely. So, you learn to deal with these things. Over time, you find a strategy that works for you, and just coming up with a game plan has really helped me.